and welcome back to my channel. If you're seeing my face for the very first time, hi, welcome. My name is Adora and you're watching Life with Adabeke. Don't forget to like this video, share, comment, subscribe, all that good stuff. If you're one of my returners, one of my OGs, welcome. Thank you so much for continuing to support me, continue to watch my videos, continue to be part of the Adabeke family. Okay, thank you guys so much. If you're new to this channel, let me know in the comments what made you click, what made you be interested, what made you want to watch my video. Okay, well, let's get into today's video. I want to talk about something that's not medicine, that is not nursing, that's not PA. Essentially, I want to cue you guys into different careers that exist in healthcare, like in the hospital. Let's just say in the healthcare. So in the hospital, that does not require you to go to medical school, PA school, nursing school. Let me tell you why, right? So as you guys probably know, I just completed my third year rotations. And part of third year rotations, going into different fields, like you're rotating through different specialties. And I was very surprised to see people with name tags or badges, and then what would be the job title. I was like, wow, I didn't know a job like this existed. And I'm like, if I didn't know that a job like this existed, I'm in medical school, I can bet you that a lot of people don't know that such jobs exist, that such job titles exist, that there's something like that. So I just decided that, you know what, let me come and share with you guys some of the job titles, some of the things that I've seen, the little bit I know about them. I don't know a lot, but the point of this video is to kind of give you a starting point so that you can take the information I'm sharing here and then go and do your own research. If something I say sounds interesting to you, sounds like something that would work out for you, then you go and Google it, you go and search up these things I'm saying, right? So I'm not here to really talk about, oh, these are the educational or anything. Like, I might give a little snippet here or there, but I just want you to hear these things so you will not say that you not hear it. You've never heard about something like this. Don't be like me that will enter into rotation and before the first time you are seeing that something exists, or this one exists. I'm like, we didn't matter at this thing or at this healthcare. I'm like, I did not know that. So I don't want you to be like me. I want you to be aware that such jobs exist. And if this is something that like if you're looking for a career in healthcare but you don't want to go to nursing school, you don't want to go to med school or PA school, maybe that's something you can explore. Exactly, okay? So the way I'm going to do it, I'm kind of going to start with the professions that I think require more degrees, like they require more specialization, and then to the ones that I don't feel like require so much specialization. I'm going to be looking down at something in case you see me looking down. So I would say is PT, so physical therapy. Physical therapy is like an amazing field. One thing about being a physical therapist is that I believe you need to go to a doctorate, like you need to do additional training to go into PT school. I think it's about 2 or 3 years. I'm not sure. This is where your own research comes in. But DPT, so Doctor of Physical Therapy, they are people who they help people to regain their mobility. Almost everybody that's been in hospital gets some kind of PT eval, like trying to get people to be able to just move better. Some people had surgery, some people like they're weak and they are deconditioned. PT are an amazing field. So if you're someone that you see yourself being able to work in that kind of field, like PT might be it might be amazing for you. So take a look at it. OT. So OT is occupational therapy. Occupational therapy is different. So whereas PT is helping you more with like strength, occupational therapy is helping you to carry out like your activities of daily living. So occupational therapy is maybe they're helping stroke patients to relearn how to write. They are helping people who have like maybe language. They're just helping you more with like, I call them fine motor movements. So sometimes we see OT in the hospital, but usually I think OT works outpatient usually. So but OT, you need to do a master's. in OT. So OT, it requires a master's degree. So if you're someone who is, maybe you're an undergraduate student, or you're someone who has finished your undergrad, but you're looking to go into healthcare, but you're not really sure, I would say look into OT, look into occupational therapy. I think it's about a 2-year program. So look into this one. I found out recently, I didn't even know something like that existed. It's called speech and language pathology. We call them speech and swallow in the hospital, but they are speech and language pathologists. So they really help us to evaluate patients' ability to swallow and to protect their airway and to like drink, eat, all that kind of thing. Because if a patient is having issues with eating or drinking, we might not ordinarily know, but they do evals and they let us know what they're recommended, like, oh, should this patient be on just liquids, should they be on semi-solid, that kind of thing. So that is almost, honestly, speech and swallow is like, so it's almost it's so rampant in the hospital. Like they are very busy. They are very busy. So if that's something that you're like, oh, I'm interested in that, look it up. So speech and language pathology. Additionally, you've probably heard of these dietitians. So some dietitians work outpatient, but a lot of them work in the hospital as well. I did not know that dietitians really works in the hospital, but dietitians help, they're helping curate meals for patients. So if someone is diabetic, dietitians are the ones that are curating what a diabetic meal plan looks like. They are seeing patients, they are talking to patients, they are counseling patients. I remember being on rotations where we had like a patient who was newly diagnosed with diabetes. We had the dietitian come talk to them because they are going home, we are discharging them. We don't want them to come back again with high. We want them to we're trying to make sure that they have like the best tools. So dietitians, they are really, really helpful. Dietitians, you can do a bachelor's in nutrition and dietetics, but for you to become a registered dietitian, I think you need to do a master's and then pass some certain number of hours or something like that. But that's dietitian, and that's a very, very much needed specialty. Another one is respiratory therapist. I'd never heard of this until I said during my rotation. So respiratory therapists, they usually work in ICU settings. Sometimes they also work in the ICU ED, I think high acuity, but their major role is really helping support patients respiratory functions. So respiratory therapists, they are helping maintain vent settings, all these kind of things in the ICU, patients on ventilators, different kinds of things like that. So I believe that respiratory therapy is a master's degree. I might be wrong, but if you're someone who wants to work in an ICU setting, that's something that is cool to you, but you don't want to go to medicine, you don't want to go to medical school, you don't want to go to nursing school, I'll say consider respiratory therapy, because they learn a lot about the physiology of the lungs and heart, how ventilators work, and how to be able to support patients who are on ventilators. So they do a lot about that. They can intubate. They do a lot. I didn't even know that they did that much, but they do social work. Hospital social work. Hey God. First of all, I think almost everybody if you're in the hospital, you have a social worker. So if you're not aware of what a social worker does, social work really helps connect patients to resources. I think in one line, that's really the work of social work. So social work is really here to advocate for patients, to know what exists in the community, know the patient needs, and bridge that gap. So if that sounds like something you want to do, social work could be for you. I think for social work, you need to do a master's in social work to be able to, and then I think while in your master's training, you can be placed in hospitals and that kind of thing, and then from there. So if that's something that you're interested in, if you know that you're more interested in the social aspect of healthcare, you're someone who wants to help patients find resources, you're interested in curating resources. So if for social work, if you're someone who that you're interested in organizing, creating content with people that just trying to create portfolios, that kind of thing, or just trying to connect people with resources. There's a lot of things that social workers do. There's a lot of things that they do, but I know for hospital social work, that's the majority of their job. They're the ones that help helping get patients. Maybe someone needs to go to a rehab, it's social work that's coordinating that. If someone needs to go into a home or a living facility, social work is the one that's coordinating that. So if that's something that you're interested in, social work might be right field for you. Another one that I think most of all these ones that I've just talked about now, they require master's degrees, or even like DPT requires even a doctorate degree. So the next few going to talk about don't necessarily, I think they mostly just require bachelor's degree. So the first one I want to talk about is scrub tech and OR tech or scrub tech. So I think for that one, you need to do a kind of certification. But in scrub tech, if you've ever watched like hospital shows or that kind of thing, you know, the person that is like, that they're like scalpel, and then the surgeon is like scalpel, and then they give them scalpel, they're like, oh, Alice, blade, that kind of thing. That is a scrub tech. So I think sometimes scrub techs are nurses, but they don't have to be. Sometimes you can just go and get training as a scrub tech, so they don't have to be. But it's not something that you need to do a master's for. You just need the training to become a scrub tech, but not like you need to get a master's degree or anything like that. So scrub tech is a big one. And if you're someone that likes, you're interested in being in the OR, that kind of thing, but you don't want to be a surgeon, or you don't want to do what it needs to, that you don't want to go that path of med school, being a scrub tech might be good for you. Radiology Tech. So Radiology Tech are the people, like when you go to get an X-ray done, they're the ones that are fitting you, doing the fitting, like they're laying you down. They're the ones that are essentially doing the thing. They're the ones that are doing it. The radiologist reads the images, but the person that is actually getting the images is the radiology tech. So as a radiology tech, you can work in X-ray, you can work in CT, you can work in MRI, different field, ultrasound. So I think sometimes they get like different trainings in that. Like I know, like in OB, you can work like OB ultrasound, you can become like a sonographer. So but all those things are like I put them in the umbrella of radiology tech. So if you're interested in those kind of things, but you don't want to go to med school, become a radiology tech, become a sonographer. Those are like amazing. That's an amazing like field to go into. It's still allows you to be able to do that kind of work, but maybe you're not the one that is interpreting, you're not the one that is like giving diagnosis, but you're able to do that kind of hands-on patient work, and it does not require like an additional degree. It does require more training, but not an additional degree, if that makes sense. So the next one that I found out about is Anesthesia Tech. So these people are working with either the CRNA or the anesthesiologist. They are helping set up like all the the ORs. They're helping set up the ORs and the anesthesia equipment like before the surgery, right? So they are setting up. They know a lot about like the anesthesia machine, how it works, how to make sure it's like working properly, how to like the different equipment in anesthesia. So if you're someone that's interested in anesthesia, or maybe you're not really sure, or you're just looking for a career in healthcare, that could be a good career for you. I believe Anesthesia Tech, it's like a 1-year program at my school, but it's not a master's degree, but I think it's a 1-year like course, and you get that kind of training, and you're able to be there. I think sometimes they are able to you can watch surgeries, that kind of thing. So, and you're in the OR, if you're someone that wants to be in the OR as well, but you don't want to be a scrub tech, that could be a good. And that one is a perfusionist. This one is actually a very, very niche one. So they mostly work in like CT, so like cardiothoracic surgeries. They help like, I don't know how to explain this one, because perfusion is like, they help when they like stop the blood flow. They're the ones that like, there's this big machine. Please, you can Google it, perfusionist, like coronary perfusionist, but like they help like maintain that machine during like when they are doing like open heart surgery and stuff. And it's actually like a whole like thing. I think it's like a whole training about it. So if you want to be part of cool surgeries like CT, but you don't want to be the person that is actually doing the surgery, that's a cool one to do, perfusionist. So the next two I want to talk about are not directly like healthcare like that, but you still get to work in hospital. Patient transport. So I think patient transport can be a good career choice for someone who maybe is looking for any kind of work. Maybe you want to work in healthcare, but maybe you want to save up money before you go get some training. For patient transport, you don't actually require any I think the hospital trains you. So you're essentially the person that is like helping move patients from one place to another. You might be moving patients to the lab, you might be moving them to, like to go and get like images, like imaging done. You might be moving patient from ED to their room, just whatever. The point is that you're helping transport the patient around. And I feel like, especially for like pre-med, that could actually be like very good, like patient contact hours. So patient transport, it can be good for maybe someone who doesn't really know what they want to do yet, or you know that you want to work in healthcare. So it can be a good way for you to see, like, do I even like being in the hospital? One is pharmaceutical rep, or not just pharmaceutical rep, but like, I'll say pharmaceutical because not just pharmaceutical here, I'm not just talking about drugs, I'm talking about like stents, like different kinds of like wiring and machinery. So like those people make a lot of money. They make a lot of money and they don't even need like any like certain like training. They just need training in their own products. But then they make a lot of money. So if that's something that you're looking into, like, or you want to like, maybe you want to kind of work healthcare adjacent, but you don't necessarily want to be in the hospital all the time, because they do come into the hospital and outpatient offices, but that could be something that you could look at. You guys, I have given people so many things. I think I've mentioned more than 10 careers, like, but is there a career that you have heard about? Is there a career that you're already in? Is there a career that you're interested in? I said, let me know. I don't want to talk about doctor, nurse, PA. Like, I wanted to just talk to you guys about other things, other options that exist in healthcare, especially if you're someone who is not sure, someone who maybe but you're not really, that kind of thing, or you just want to make money, so you cannot dedicate 4 years, then residency. You just want to like, let's just enter this money quickly. These careers might be good for you. So like I said, I just wanted to give you guys a snippet. I'm not going into I don't even know the details about all these things, but it's for you to at least have heard these things for the first time here, so that you can go and do the research on your own. Okay, thank you guys so much for watching my videos. Continue watching my content, because more and more content is coming for you guys. I have a whole host of things planned, but thank you guys so much. Until the next time, I remain your girl, Adabeke. Don't forget to like this video, share, comment, and subscribe, and tell me in the comments what's your most surprising career to find out about was. Till next time, bye.